Hello friends. So let us continue our topic of female urethral microanatomy, and today I have brought for you some information about the periurethral ducts and glands. This is the female urethra, as you know, bladder neck and the entire urethral tube, and then this is the external urinary meatus. There are many ducts which open in the female urethra. They traverse downwards. They are opening in the urethra in an oblique fashion, number one. And the distal urethra, the distal half or distal two-third of the urethra has maximum number of ducts opening in them. As you go higher and higher, these ducts become scanty, and in the proximal one-third of urethra, there are no ducts opening. You should also know that if this is the circumferential section, if this is the cross section of urethra, and this is the dorsal side, and this is the ventral side, a pair of ducts open from ventral side and they are called ventrolateral duct, and a pair of ducts open from dorsal side, these are called dorsolateral ducts. In another animation, this is the dorsal view of the urethra where you see many ducts opening inside the urethral lumen. This whole tube is urethra. And this is the ventral view where you see less number of ducts opening in the urethra. So, bring you again to the question of why the nature has made the opening of these ducts set in this oblique fashion. If this is the normal urethra and duct arrangement, when patient voids, the urethra dilates like that. And as urethra dilates, you will notice that these ducts get more oblique and that these ducts also get compressed. So see, this is the normal arrangement and this is how when it opens. Can you appreciate change in the caliber and the direction of these ducts? So because of this occlusion of these ductal orifices and the ductal tube itself, because of the obliquity, when patient is voiding, there is no reflux of urine in these ducts. That is the purpose of the obliquity. Talking about the glands, these ducts end up into glands, and these glands are compound racemose glands. If this is the urethral wall and this is the small duct, over a period of time, these glands multiply, they branch out, and they become something like this. So there are many glands which open through independent ducts and then into the urethra. So they are compound racemose glands. Long time back, Dr. Hoffman published a remarkable study which has the landmark in the anatomical study of periurethral glands, and this was as old as 1948. And I had an opportunity to read this paper in detail, where he had shown such diagrams in huge detail. They are wax models. So what you see here in orange is urethral model, and what you see as a labyrinthine structure are the periurethral glands and their ducts, and this is the vagina here. So between the urethra and anterior vagina, the periurethral glands form a labyrinthine mass, and then there are many ducts coming out of it, opening in the urethral lumen. You may ask me this question: what is the function of periurethral glands in female? This has been debated for a long time, and people have had their own views about the functions. But what we feel today is that the major job they do is that they keep producing some mucoid fluid, and this mucoid fluid serves three purposes. Firstly, it lubricates the urethral mucosa from inside, so the passage of urine becomes frictionless and easy. Second, this mucus lines the urethral mucosa. So just by the virtue of its stickiness, it provides mechanical barrier to the ascent of bacteria inside the urethra. I told you more mucus is present in the distal half of urethra. Therefore, distal urethra has a better guard. And then this mucus also has immunological property. It has some antibodies in it, because of which it can launch an immune attack on the offender, the pathogen that is attempting to come inside the female urethra. So mucus has huge role in prevention of infection in a female. And thirdly, just by the sheer lining of mucus on the urethral mucosa, the occlusion of the urethral lumen becomes more watertight. So it improves the urethral seal. What we have learned now over the last some few years, that if you look back in this diagram where I told you that the glands are located between the urethra and vagina, anterovaginal wall. What we have known is that behind these glands or all around these glands, there are many neurons and neuronal fibers. There is selective condensation of neuronal fibers between the anterovaginal wall and the back of these glands, like this. If you see in this animation, these are the periurethral glands, and that's the duct and the vagina. And here you will see many neurons. And this area of the anterovaginal wall had been described as G spot. G, after the Grafenberg, would describe this in anatomical detail. And he said that this part of the anterovaginal wall, which is about 2 centimeter area, just behind the urethra, is sensitive. It is also erotic to some degree, and it helps in inducing female orgasm. So that is the purpose of these neurons located at the G spot. If you see this in a cut section, these are the glands and these are the neuronal fibers, and that is how is the G spot. Now what is the G spot doing? Why there are so many neurons behind these glands? When this G spot is stimulated in the sexual act, and these glands are stimulated to produce more fluid, and then there is some talk about female ejaculation, which means at the end of the orgasm, some females produce fluid which come out of the urethral orifice, and it has been akin to female ejaculation. To my mind, this is an additional mechanism of protecting urethra from infection. Whatever pathogens enter the urethral lumen in the sexual activity are expelled out by this fluid. So today we add a fourth function to these glands, and which is a neuro-paracrine function, whereby they can produce this fluid, the exact purpose of which is not known today. These ducts and these glands are involved in number of pathologies in female genital tract, and I'm sure you must have treated many number of them. It can get swollen up to create periurethral adenitis. You may have actually felt some kind of induration and thickening behind the female urethra in those patients who have recurrent vaginitis, gonococcal vaginitis, urethritis. The gland become actually a swollen mass, indurated mass behind the urethra, and make the disease very chronic. So, and if you see in this diagram, and this is the duct and leading to gland, when there is an inflammation around these ducts, this duct becomes occluded, and there can be formation of a periurethral abscess, and this abscess can expand. This can even become sterile abscess because of antibiotics, and then one fine day this will rupture higher up in the urethra, and then it forms what is called a urethral diverticulum. So periurethral adenitis, periurethral abscess, periurethral cysts, periurethral diverticula, huge number of diseases can result from these periurethral glands. So these are, although not so well seen during surgical dissection, but they actually exist and can be a cause of a lot of trouble. So thank you very much. In case you have any questions or comments, write to me on my email. And have a very good day. Bye-bye.